A very good afternoon and welcome to our session on the topic urinary tract infection in children. A very important topic, and we are glad to have our expert Dr. Soumya, who will talk about this briefly. The doctor will help us understand the importance of each and every detail this topic involves. I will request you to pour out all your questions and all your doubts in the comment section so that the doctor is able to answer your questions. Doctor, you have the stage.
Hello, good evening, everyone. I am Dr. Soumya, consultant pediatrician, Apollo Cradle Hospitals, Jaya. I have already spoken to you about few of the common diseases like diarrheal diseases, upper respiratory tract infections. Today, I am going to talk about one most important infection called urinary tract infection, which is very common but most neglected, and most probably they end up in complications where it cannot be reversed if it leads to kidney failure or renal scarring. Today I am talking about UTI because of late during Corona times, whatever fever was considered as viral fevers, and many cases of UTIs were missed, and improper diagnosis and antibiotics which were used for UTI. We couldn't diagnose UTI properly and mismanaged several times. It led to many complications in children. Yeah, that's why I took up this topic today. Urinary tract, we all know, they have anatomically, first I'll explain you there are two kidneys, and the ureters means the tubes which connect from kidney to a bladder, which is a bag like thing which collects the urine. From there, urine is let out through urethra. Urinary tract infection can be lower urinary tract, means ending in only in the bladder as well as the urethra, or it can be up above where kidneys and ureters are also involved. It is very common. Less than 5 year old, at least 8% of the girls and 3% of the boys in less than 5 year old age groups tend to get it. And the symptoms are not classical for a smaller baby. Whereas in an elder child, they can point out to the symptoms, and in a newborn or in a smaller infant or a toddler, they cannot specify their problems. So it becomes a difficult task for parent as well as doctors for us to diagnose based on the symptoms. First, we should know how our urinary tract is protected from getting infection. Our kidneys have where they filter the blood and form urine. From there, it goes to the ureter. Usually, ureter to bladder, bladder out, and that means antegrade flow. There is no flow back from bladder back to the kidneys. So God has given us valves where from the bladder it goes to urethra, right? When it is let out of the system, there is a valve which protects us from bacteria entering retrograde. And also kidneys to ureter, once the urine comes to ureter, it cannot go back to kidney. But in some instances, babies who are born with some genetic problems, like who are inborn with some kidney diseases, like if they have two kidneys, one side, or double ureters which are just twined up one upon the other, or shoe kidneys, or even the kidneys where there is a valve which is not letting the urine go out of the bladder properly, or if the child is mentally ill, or there is any spinal dysraphism, means where his spine is not working properly with the nerves being tangled, and the bladder which usually empties the urine is not working properly. These are the kids who are at risk. But what commonly causes why the age of less than 5 years and it is caused is because younger girls like less than 5 years, when 2 to 4 is the most common age, and girls are more predisposed than boys because girls have shorter urethra, and the urethral opening and the anus, which is the where they pass motions, is very close in girls compared to boys, which has a little more distance, longer urethra. So girls are more predisposed to urinary tract infection, especially during the toilet training days. And by cleaning it properly, this can be protected. Why this incidence is more in girls is they explain, but in boys also, younger kids who are uncircumcised, they can also have infection because the skin, which is a prepuce, which is foreskin in the penis, if not cleaned or if not retracted and cleaned, I've seen several kids who are hygiene is not maintained properly, can also have urinary tract infection. It can be most of the time it is bacteria because our gut has the motion where we have stools will have normal many bacteria in them. So those bacteria can ascend through the urinary tract from down through the urethra. Very, very rarely it can be a infection which is spread from elsewhere, descended through blood, and it is spread from anywhere else the infection is there. It goes to blood, and from there else it spreads to the kidneys. Most commonly, it is ascending infection because the most commonly found bacteria in the colon is E. coli, which is commonest thing which we see in urinary tract infections, and they ascend from the urethra upwards to the bladder. But our bladder has got good mechanisms to empty it. If you're regularly emptying your urine, you're not letting it stay in the bladder, your bacteria will not thrive there. And we have that pH which is not suitable for the bacteria to stay in the urine and give infection. These protective mechanisms like regular voiding, drinking lot of water, 1.5 2 hours once if the baby is in void the urine, and the urine is not let back in the bladder, chance of infection is very low. But in some cases where the kidneys, like all the anatomical features are okay, but child is not being able to evacuate the bladder at timely intervals. Like most of this time, this happens in a school going child, especially a girl child who is missing out on bladder emptying. Means they don't want to empty the bladder on time, be it because they don't find the toilets clean, or they want to because they can't keep going out of the classes when they feel the urge to pass, they we hold the urine. So when they hold the urine staying in the bladder can act as a focus for the bacteria to grow well. So a bladder should not be left with residual urine for long. It should be flushed out as and when by drinking a lot of water and voiding it and completely evacuating their bladder. So if any mechanism of this is being interrupted, chance of infection is very high. So once bacteria enters, what are the common bacteria? Is, as I told you, E. coli, but very rarely some other bacteria like Proteus, which is serious than the E. coli, and Klebsiella, Enterococcus. These are rare bacteria. Some cases we do see viral infections also causing UTI and fungal infection. Fungal infection is usually in those cases who are immunocompromised children, who are in the hospital, who have got a catheter in the urethra for a long time, or the child has been on an antibiotic for a long time for some other reason, develops an fungal infection in the urinary tract. And that is more notorious compared to the bacterial infections. And coming to how they manifest. So, see, I can group it as newborn period, toddler period, as well as the younger school going children. Newborn period, usually we suspect UTI if the child develops high fever, child is lethargic, not feeding, not active, and not gaining weight. Your otherwise child will be afebrile, means there won't be any fever. Child looks all well, but not gaining weight, and we are not able to manifest. They cannot show how is there any pain or during micturition. Parents also cannot make out because they're always on diapers, and usually newborn babies do empty the urine very frequently and small quantities. So it is very difficult as a parent or a doctor to know just by the symptoms. So any child failure to thrive means not gaining weight according to whatever age they gained per day, or if the child has long prolonged jaundice. Usually jaundice usually appears after third day, peaks up by 7 days, comes down by 10 days to 15 days. Some babies it gets so prolonged that it will last beyond 15-20 days or 3 weeks. Then or with lethargy and other factors associated, we must have to rule out urinary tract. And this especially in a newborn period, I advise all the parents, especially a girl child or an uncircumcised babies, most of the time we don't circumcise, so we encourage them to clean the vagina properly. So when the baby is discharged, we explain them how to clean it and how to avoid infection happening. And diapers, sometimes they are let in the baby for a longer time without changing. The stool which is there in the diaper can help the bacteria to ascend through the urethra. So make sure baby's vagina or the urethra is clean from front to back, not from back to front. So back to front, if we do, the bacteria from the anus will only be inducing it to go to the vaginal area or the genitals. So the newborn period is these are the symptoms: vomiting and irritability, drowsiness, sometimes very high fever can lead to convulsions, lethargy, and all these things. Little older children like 1 year, 2 year old can have high fevers unexplained. Means child will not have any cold cough. Child will continue to have high fever more than 39 degrees, or child will have irritability, excessive crying, pointing out to that organ, just rubbing there or crying excessively. If a boy child or a girl child, small quantities they pass, they cry, and again they pass and cry. Usually, in a newborn or a small baby, when the bladder is in like full, they cry, and after they void, also they cry because it is wet. And but in a child who has UTI, they will have intermittently like they pass two drops, they cry. Especially in a boy, the stream like a fountain doesn't happen. It happens with few drops, excessively crying, again dropping. This can be a symptom. And if we are able to notice, there is discoloration of urine, high colored urine, foul smelling urine, cloudy urine. If we collect and see, usually our urine should be very clear. And the more the clear it is, better for the baby. If it is cloudy, foul smelling, blood, or any high colored urine, we should also suspect that it can have urinary tract infection. And child in a little older child, it is very typical. They can explain all their symptoms. Like a school going child can clearly tell that the child has pain while passing urine. Child feels like passing urine very often. Child feels baby has emptied the bladder just now, but again wants to re-empty it, and feels that she has not done or he has not done the emptied the bladder properly. Or if the baby is complaining of any pain, especially lower abdominal pain, just above the pubic bone, or if the child is saying any back pain, which is migrating from back or the sides of the abdomen, child having nausea, vomiting, and chills, especially urinary tract infection is suspected if the child has no other focus of cold cough, but child is having high fever with chills. So most of the time when the fever is there with chills, as a pediatrician, we would like to rule out urinary tract infection. Children who are and another problem they might face is child is already toilet trained, never has been done any bedwetting, but now starts to wet the bed. Then or baby is unable to control the urine. Sometimes daytime also baby is not able to control the urine or wetting is happening. Then it shows that it should ring a bell that there might be urinary tract infection. And when we suspect urinary tract infection, we have to rule out before starting treatment. It's a very easy treatable condition. But if we already child has taken some antibiotic, we will not be able to diagnose urinary tract infection properly to know the cause, which bacteria has caused, and all. Is the bacteria sensitive to what medication we give or not? So always when we suspect, first 3 days, if the child has not taken antibiotic, it is always good for parents, child, as well as for pediatrician like us to treat urinary tract infection. Pyelonephritis is the infection which is causing infection in the kidneys, and cystitis is infection in the bladder. Cystitis is less serious compared to pyelonephritis. Cystitis will have more burning sensation, more frequent urination, and just incomplete voiding or wetting or irritation in the lower half and tenderness in the lower abdomen. Whereas kidney infection is high fever with severe back pain, vomiting, high grade chills, child looking unusually tired, and child is vomiting too much persistently, we should think of higher urinary tract infections. So, if that some now, especially whenever the child complains of burning sensation or frequent urination, what mothers or grandmothers do is they say nothing. There is some heat. Child has eaten heat objects, which eat food, something like that, and they start giving only tender coconut water, barley. Yes, it helps because you're flushing out the bacteria from the bladder, which was collected there, and it is causing cystitis or irritation in the bladder mechanism. But that is not the treatment. It is just helping you to reduce the pain or irritation, but it is not letting you the bacteria to be killed. So never do that and leave it alone. Always go to a doctor and get your child's urine tested and in a proper way. So diagnosing urine in a smaller newborns or an infant collecting urine is a bigger task. So what we do if we are really suspecting a urinary tract infection, we must collect clean midstream clean catch urine, which becomes a bigger task for smaller babies. We put a urine bag, though it is not 100% specific or sensitive because it can have a bacteria which is in the urethral opening, skin, around the anus. When the baby passes urine, those bacteria can collect in the urine bag. But we try to clean that properly and put a bag and collect and send it for culture. Best thing is to catheterize the baby. If you are really seeing a sick child, we would like to catheterize and collect the midstream sample, collect the sample. Or in a sick baby, we will do suprapubic puncture. We do a needle we take directly go through the abdomen, collect the urine sample, and send it for cultures. Gold standard is always cultures. Urine routine will just tell us whether bacteria is there, pus cells are there. It just acts like a screening test. So when we do a urine routine, we just get to know yes, the child has UTI, and then we wait for the culture because culture takes 2 to 3 days for it to come with the definitive diagnosis. Meanwhile, we can't wait for a sick child. So after routine is showing some pus cells, and we do also do a urine nitrate test and estrase test. These will give us a clue if there is child is suffering from urinary tract infection. Such kids, we do empirically start off with a broad spectrum antibiotics, waiting for the definitive diagnosis to happen in 2 3 days. Once we start antibiotic, dramatic improvement will be there in a small baby, and child will start improving. In a slightly older child, in a school going child, we collect through a container. You never have to do it through the containers which you have it at home. How much ever you wash, it won't be sterile. So we give you sterile containers. What I advise for a girl child is parents should make the child sit in the bathroom, open up the labia, wash it thoroughly, then collect the midstream sample, which is after few drops the baby passes urine. Middle of the stream, you are supposed to collect the urine and give it to the lab as early as possible. If you can collect in the hospital premises, it's good. Or if you are doing it at home, do not keep it for more than half an hour. You just have to hand it over to the lab technician within half an hour because every half an hour the bacteria doubles. Or if you're collected night and you want to give it later after 4 5 hours, you should keep at 4 degrees Celsius in the fridge. And the second thing is after collecting and diagnosing, we'll be starting antibiotics. And if the child has responded well, according to the culture sensitivity, either we change or we stick to the same, but course of 7 to 10 days. What I see in parents is 1 or 2 days they give. Once the burning sensation has settled, they tend to stop the antibiotics, which is not right because bacteria will not have died. It would have come down in numbers, but they again cause infection after a few weeks or months. So never do that. Complete the course of 7 days. It's ideal to repeat a culture after 7 days to see if the urine infection is still persisting or the child is being treated properly. And there are some more modalities of diagnosis, not just for all the urinary tract infections. Any child who is less than 3 years old, especially less than 2 year old, febrile UTI means you have got infection and the child had high fever, we should always evaluate for any underlying cause for the UTI. What are the underlying cause? As I told you already, we have kidneys with ureter and bladder, right? So any anatomical lesion would cause high grade fever to happen because kidneys must have got infected. So what we have to do, any child less than 2 year old, we do a screening ultrasound. That though it does not clearly say which part of kidney is involved or how much the kidney has gone wrong, it will only give us anatomically whether kidneys are swollen or the from kidney whatever ureter comes, is it swollen, any obstruction in the urinary tract which is happening either be it by a stone or by a mass, or if there is any retrograde flow. Means urine should only come from kidney to bladder. It should not be going from bladder to kidney. So if we feel that kidneys are enlarged and ureters are enlarged without obstruction, without any block in the passage, it can be reverse flow which is happening from bladder towards the kidney. So such kids, when we are seeing ultrasound is showing any abnormalities, we further go ahead with few more tests. So I would recommend all the parents less than 2 years, if your child has got UTI, never hesitate to do a scan, which is not going to expose the baby to too much radiation. Go ahead with the scan, and if the scan is okay, we will just wait and watch. But if the child has getting recurrent infections, be it febrile or afebrile, but culture positive recurrent UTI, and child is not growing well, child has failure to thrive, and such cases, I recommend further evaluation, which are in the form of, we do cystourethrogram, means we give dye, we put it through the urethra, then we see the flow of the urine. If the urine is coming from bladder out towards the urethra, or is it going from bladder up towards the ureter. So this gives us a clue whether the child has vesico-ureteral reflux, or is there a valve which is not allowing the baby to empty. And also in some cases where on examination, when I'm seeing a baby, you feel there is a mass somewhere, or child is bladder is always full, it is not being emptying properly, or child is looking, see some babies around 10, 11. I had few two kids, especially 10 to 11-year-old boy who came first time to me. When I saw the baby was very anemic, baby who had short stature, was not gaining height weight, they came for height weight. But when I examined thinking of anemia, I could see that child is having some underlying problem with the kidney. Child with kidney disease also had severe anemia, failure to thrive, growing short and almost always fragile. Such kids, we always, that was a case of vesicular reflux with kidneys being swollen. It was not managed and it was not diagnosed. By the time I diagnosed, child had both the kidneys scarred and both the kidneys were failed. So in such cases, we had to do transplant, but so sorry that we couldn't save the child. So I thought very, very important to stress upon this child case, that any child, high fever, recurrently getting urine infection, we should further do it. The scans, two scans which we do, which is VC, vesicocystourethrogram, and also if there is any problem like this, and we do a DMSA scan, which tells us a radionucleotide is injected through the IV, that goes and it is taken up by the kidneys. That will show us where there is, how much of the kidney is functioning, how many scars are there, how kidney is affected by these UTIs. Recurrently, this infected urine going back from the bladder to the kidney has scarred the kidney. So scarring has led to the shrunken kidneys, and kidneys can't function as before. Such kidneys are going to cause later early onset hypertension in a child. Might end up with 30 by 30 high hypertensions and renal failures, and failure to survive also if the kidneys fail both the sides. So I would recommend the MSS scan for all the children who are recurrently getting infection. If nothing is there, well and good, but better to rule it out. After having said all this, when it is such a serious thing, how well we can protect the child from getting, why my child is getting infection, I am cleaning it so well, I am doing cleaning from front to back, still why is it getting. Some are genetically predisposed, but some overdoing, so like washing, if the child, especially they say girl child in a sitting in a bathtub for a long time with fragrant filled soaps, they alter the pH of the vaginal flora. So the bacteria can easily attach itself to the urethra and ascend. So I would not encourage any bubble baths. Always have this toilet training is to be taught properly, especially boys and girls in a younger age. Well trained is better, because boys, you ask them to retract the foreskin, clean the front of the urethra properly, and every day retraction is very, very important, because that bacteria which grow, it acts like a good stage for the bacteria to grow. So I want you to clean it properly. Girls also front to back, as I've told you. And you can use lukewarm water to clean it only, no need to use wipes. Even in small babies you can use lukewarm water to clean. And especially school going children, I would ask even the school authorities to make sure that the toilets are clean and child is being happy to empty there. Otherwise, they postpone. I am seeing kids who come with UTI. When I ask, why don't you drink water? they mostly complain about school toilets. So I would either whoever teachers or school authorities, parents, when they go and meet parents teachers meeting, they should particularly stress upon this. Toilets to be kept clean. Girl should be has to clean properly hands as well as the hygiene over the genital area. And after that, the drinking water should be stressed very well. Drinking water is why it is important. Both it protects you from urinary tract infection, also protects you from constipation. Constipation is one of the reason for urinary tract infection, because constipation, when the bowels are full and it is loaded, because bowel and bladder just face one another, one up in front of the other, the loaded bowel can press upon the bladder and bladder will not be emptying it completely. So urinary retention can lead to infection. So ask your child to have proper toilet training. You teach them to empty the bladder daily and also use the toilets at least in short breaks and long breaks. The breaks are given just not to eat and to chat and play, also to empty the bladder on time. So that timely voiding, drinking lot of water. Children minimum, because they stay 6 hours or 8 hours in the school, I would recommend 1 liter in school and coming back and at home at least 1 to 1.5 liters. Minimum 2 liters child has to drink water to empty and to have a clear urine voided. And other things is if your child has got any cerebral palsy or any other major complication where neurogenic bladder means baby is not able to empty, teach them use catheter and try to empty the urine. The other things are hygiene. Apart from that, investigations, untimely diagnosis is important. Treatment, usually we give treatment after collection of urine and start on antibiotics. As I told you, broad spectrum antibiotics. What I feel very sad is whoever comes on day one of year already has started an antibiotic by themselves, showing that last time we had given this, we have tried all this. And when we collect urine sample after 3 days of what you have given, we get definitely a negative culture, which will not give us any shows, any light to treat further. Please never use antibiotic in the first 3 days. Wait and watch until unless they point out clearly on day one that it is urine burning sensation or red urine or frequently passing urine. We can there in first day only you just go for a urine test before starting antibiotics. Never use over the counter medications. Fungal infections, skin hygiene should be taught well. If there is any itching or any anal itching. Sometimes the kids have pinworm infestation, which is they feel like itching the anus because pinworms cause bites there. So they put their finger there, they itch, and again they put the finger same in the vaginal area. That can also cause infection. So pinworm also has to be treated properly. And the skin do not have to apply any powders or any rubbing too much, because the damaged skin there also can cause bacteria to ascend. Few differential diagnosis, what I would say for urinary tract infection is most commonly it is viral, if it is not UTI with high fevers, or vulvovaginitis in a child. If a small child, it can be just the vagina, the labia, the skin coverings where that is infection because of either dry skin or fungal infection or any bacterial infection in the skin area. So that's why we say labia should be separated when you collect urine. That rules out either the skin infection there or inside urinary tract infection. And we should also look for complications like renal failure, hypertension in any child, and treat it accordingly. Uh, I think I've covered up. If any questions, I would ask the audience to come up with. Thank you. Next. No questions. Thank you. Done now?